Okay, so today we'll see sulfonamides. So firstly, what are sulfonamides? Sulfonamides are first antimicrobial agents which were found to be effective against pyogenic bacterial infections. So basically, pyogenic bacterial infection are the bacterial infection which involve pus formation. Sulfonamides were earlier widely used, but now their use has been restricted as most of the organisms have developed resistance against it. However, they are still used in combination with trimethoprim, which is called as cotrimoxazole, or with pyrimethamine to treat malaria. Coming to the classification of sulfonamide, there are basically four classes: short acting, which is sulfadiazine; intermediate acting, sulfamethoxazole; long acting, sulfamethopyrazine; and special purpose sulfonamides, silver sulfadiazine or sulfacetamide sodium. Now, these sulfonamides are primarily bacteriostatic, that is, they just inhibit the growth of bacteria and do not kill them. However, the bactericidal concentration might be achieved in urine. Coming to the mechanism of action, so folic acid is a compound necessary for all the cells to synthesize DNA, and in bacteria also they require folic acid. So many bacteria synthesize their own folic acid by taking up the constituent from the surrounding. PABA is a constituent, para-aminobenzoic acid. Now what does the sulfonamide do is, they are structural analogues of PABA, and so they inhibit bacterial folate synthesis, which further inhibits synthesis of folic acid. However, sulfonamides do not affect the host cell because the host cell do not synthesize folic acid. They get pre-formed folic acid from the diet. So sulfonamide, what it does basically inhibits the union of PABA with pteridine residues to form dihydropteric acid. Now this dihydropteric acid, when formed, was supposed to get conjugated with glutamic acid to produce dihydrofolic acid, which is a precursor of folic acid. However, sulfonamide has stopped it in the initial process, and this formation of folic acid will not happen. So now, how does the organisms develop resistance against it? So either the organisms will start producing greater amount of sulfonamides, which will, the organisms will start producing greater amount of PABA. So there will be competitive inhibition, and bacteria will be able to utilize PABA instead of sulfonamides. Or folate synthase enzyme has become, the organisms have evolved in such a way that the folate synthase enzymes will have low affinity for sulfonamides. Or maybe they'll adopt an alternative pathway for folate metabolism. Quickly talking about the pharmacokinetics of sulfonamides, they are oral preparations, well absorbed from gut, plasma protein bound, and are metabolized by liver by the process named as acetylation. This is important, why we'll see later. Coming to the adverse effects. What are the adverse effects of sulfonamide? So basically the acetylated product, what we got after metabolism, are poorly soluble in acidic urine, and which may lead to crystalluria or hematuria, or even obstruction of the urinary tract. This may be avoided. How to avoid this? Either drink plenty of water or alkalize the urine by giving some alkalizing drugs. This is the first adverse effect of sulfonamide. Apart from this, sulfonamide might also cause hypersensitivity reaction. Now we know when the hypersensitivity reaction comes in, there will be skin rashes, urticaria, drug fever, etc. However, there is something more severe seen here, which is Stevens-Johnson syndrome, which is the most severe type of hypersensitivity reaction seen with sulfonamide. Apart from that, some common adverse effects are seen like nausea, vomiting, epigastric pain. If there is a person with G6PD deficiency, then hemolysis might be seen. Kernicterus may also be seen in premature babies whose blood-brain barrier is not well developed. Now, what are the drug interactions? They act as an enzyme inhibitor and inhibit the metabolism of certain drugs, potentiating their actions like phenytoin, methotrexate, and oral anticoagulant. The most important part, what is the therapeutic uses of sulfonamides? So, along with trimethoprim, they are used for treating malaria. Along with trimethoprim, they act as cotrimoxazole, which is used to treat various bacterial infection, and along with pyrimethamine, they are used to treat malaria and toxoplasmosis. Sulfasalazine is used in treatment of ulcerative colitis and rheumatoid arthritis. So basically, for sulfonamide, you need to see the general points, the mechanism of action. what is the adverse effect, and what are the uses.